Hello, I'm Dr. Kathleen Wills from Optimal Wellness Limited in Epsom, Auckland, New Zealand. I'm an integrative medical doctor, and I work with the best of conventional and natural therapies to give you, to get to the cause of your symptoms, not just treating the symptoms. So I'd like to mention, last week we talked about fibrocystic breasts. So you can check that out online at drkathleenwills.com. what I had to say in my video about that. And today we're going to talk about another women's health issue that's very common, and it's targeting the cause of endometriosis. So oftentimes when we go to our GP and we have a lot of pain, severe cramping, and it might be cyclical or it might be all the time, and this can be for long periods of time in our reproductive region, in our abdomen, etc. We're given tests to check our hormones, our thyroid, all of these types of things associated with reproductive pain. However, did you know that there are some natural therapies that can really help you besides having the tests and getting onto the birth control pill, which is synthetic hormone replacement, or other synthetic hormone replacement therapies? So let me tell you a bit more about endometriosis before we talk about some of these alternative treatments. Endometriosis, what this actually is, it's when the endometrial, or the reproductive, the uterus, you know how you have your normal menstrual cycle, it's when that endometrial lining leaves the uterus and it implants these endometrial tissues onto the ovaries, onto other organs in the body, and of course you're going to feel pain if you have these abnormal masses in your body where they're not supposed to be. So that's actually what's causing the pain, and that's what we're trying to reduce. We're trying to stop the body producing this abnormal endometrial growth and start the reproductive system flowing the way it's supposed to go, the way you're supposed to build up the endometrial lining premenstrually and then shed it during menstruation. Okay? Endometriosis can really be a life-disrupting condition for many women, typically between the ages of 24 and 40 years old. This pain can actually be really excruciating. It can really affect a woman's daily life. And it's very interesting because there are different stages of endometriosis. It can be in the early to mid stages where you can actually do some preventative measures to prevent it from getting to the late stages. Because if it's caught too late, if it's in the late stages, unfortunately, many women, even young women, have to have a hysterectomy or their reproductive organs removed. Therefore, they're not able to conceive after that. Well, the causes of endometriosis, let's talk about those. They're pretty complex. It can be hereditary. If you have a first-degree relative, like a mother, that had endometriosis growing up, it's 6 times more likely that you would have endometriosis. Other risk factors for endometriosis include estrogen dominance, so this is when your hormones are imbalanced and you have a higher level of estrogen. A lack of exercise all of your life seems to be a potential risk for this. A diet high in fat, and a use of IUDs for birth control. Another interesting factor is exposure to environmental toxins. And sometimes this can be due to just a low immunity of your body, gastrointestinal function, and the frequent use of alcohol. So while late-stage endometriosis may only be addressed by surgically removing the reproductive organs, we can do things to prevent the late stages occurring. So what I would do at Optimal Wellness Clinic in Epsom, Auckland, is I would do some tests on your hormones and some evidence-based lab work to check your hormones, check your thyroid, all of these sorts of underlying medical conditions that can contribute to endometriosis. We would do a gynecological examination of the endocervical masses And we would decrease the inflammation, balance your hormones, heal the gut. So other measures I would look at to help you with endometriosis: dietary modification. This is very important. This includes measures to reduce inflammation. So fish, garlic, fruits and veggies. We look at nutritional supplementation, so vitamin C, beta-carotene, vitamin E. Maybe some herbal medicines as well are quite good. Chaste tree is good at balancing your hormones. Prickly ash, motherwort. These are all combinations we can work with. Everyone is different, so every combination can be individualized for each patient. Bioidentical natural hormone therapies we talked about, which is progesterone cream. It's a very simple cream you rub on your arms. Looking at gastrointestinal support, so probiotics, slippery elm, measures to really sort out your gastrointestinal functioning. So if you'd like to know more about endometriosis, you can always contact me at Kathleen@drkathleenwills.com, or you can give us a ring at the clinic, Optimum Wellness Center in Epsom, Auckland, for a Skype appointment or for an in-person appointment with me. The number there is +64 if you're international, 09-623-6234. This is in Auckland, New Zealand. Thanks very much, and remember to check out my other videos at drkathleenwills.com. Thanks.